Hi, I am Dr. Ramakrishna Chowdhary, Consultant Head, Department of Neurosurgery at Arete Hospitals. Today we are talking about head injuries. Coming to head injuries, it is one of the leading cause for death throughout the world. So, major cause of head injuries is due to the road traffic accidents. So, the head injuries vary from a mild concussion to severe form of head injuries called as diffuse axonal injury. But depending upon severity of head injury, person can have symptoms of mild headache or loss of consciousness to severe head injury where the patients may come to the hospital in a stage of coma. So, depending upon the severity, the treatment varies. Most of the head injuries can be managed conservatively. There is a mild concussion, small hemorrhage within the brain can be managed conservatively. The patients who come to the hospital were very much conscious for a while and they may go into a deep comatose stage over a period of time due to the increase in the size of the hemorrhage within the brain. So these kind of scenarios can be well managed in the casualty because we do advanced imaging studies to look for any increase in size of the bleed. So depending upon the bleed, we then take up the patient for surgery if required. So as I said, most of the head injuries can be managed conservatively, but few cases where the head injury is quite severe and the patient on scan shows there's a large hemorrhage within the brain or over the brain under the bone, and causing the mass effect or the pressure over the brain, which is detrimental to the blood supply to the brain. So in these cases, the patient need to be taken for emergency surgery to evacuate the clot and relieve the pressure on the brain. So depending upon the variety of bleeds, whether it's only a bleed or this is swelling in the brain. So for the bleed, we remove the clot and keep back the bone. For the cases where along with the bleed, there is a surrounding brain is swollen or it's quite edematous, in that scenario, we need to keep the bone in the abdominal wall so that we give some space for the brain to expand. Overall, treatment done at the right time, the recovery is quite good. It's always better to avoid head injuries. This prevention is better than care. But as you know, accidents are bound to happen. What are the precautions we take? So we need to go to a center which have advanced ICU care, good emergency care and good post-operative care to provide the good results. So it's always better to have a preventive measures. So what are preventive measures you can take to avoid road traffic accidents? As you know, as a two-wheelers, we have a lot of two-wheeler drivers in India. So it's always better to wear the helmets. Not only driver, even the pillion rider should wear a helmet to prevent the head injury and prevent in case of accidents. For the four-wheelers, it's always mandatory. You need to wear a seat belt. Not only driver, the co-passenger, even the rear passengers need to wear the seat belt to prevent the severity of the injuries to the body. And apart from that, always the people should follow the road traffic rules. They should follow the signals and they should always take care of the speed limits, not go beyond a speed where you can't control the vehicle. So it's always better to avoid a head injury rather than go for a treatment for the head injury. Accidents are bound to happen and head injuries are quite fatal. So managing at the right time and giving the good care in the intra-op and post-operative care can give the best results to the head injury patients. Thank you.